Growing up, my mother was reluctant or hesitant to go to the doctors. She didn't speak English, so I was there to translate for her. But this wasn't enough for her. She wanted to feel like she could communicate with her doctor. I decided to spend the rest of my life addressing this disparity and seeing if there was a possibility for culturally competent healthcare.
Pipeline programs enable us to reach out into communities and find young people who may be interested or even not thinking yet about careers in medicine or health sciences and get them excited about the potential of that being a part of their future. They get mentorship in preparation for the MCAT or the dental admission test. They get advice on how to do better in their coursework to make sure their grades are adequate, and they get overall mentoring and opportunities to shadow real-life clinicians in practice to get more excited about their potential future.
My family has never been to college or high school. I don't know about the process, and I need programs like this to be able to educate me and give me an opportunity to actually succeed in my goals and in my dreams.
If you're considering a career in medicine, there's no way that you can become a physician without having mentors. Someone that you can talk to about what it's like to be a doctor and how you're able to really be a good scientist, but also a good person and care for these patients.
It's important that students know that all things are possible and that there are careers available to them that they may not have been exposed to. And if they aren't exposed to them, how are they going to know that these careers even exist?
I wasn't sure whether I wanted to become a physician or do biomedical research, so now I have more opportunities to look into different areas of this field.
My first goal is to give them an exposure, a real life experience in the laboratory. Young people really need to see what's out there. They need to touch it, they need to feel it, they need to have that experience. The second thing I wanted to give them was an experience to see what research is about. And hopefully my goal is to get them excited about research.
We've done a lot of leadership building courses, allow us to become more confident in ourselves and confident as medical school applicants.
We cover everything that you would need to apply, but in addition to that, we serve the community. So we went on the Wilmington and Gardenia health fairs, and there we got an opportunity to work with the underserved communities.
All of those populations, a lot of them didn't have health insurance, a lot of them didn't speak English, and just serving them and giving them just little things that they don't have, like blood pressure screening, eye exams. It's very, very simple things, but things that they cannot afford.
I think it's an opportunity for students to see all things that are possible, to see that there are people to encourage them, that there are role models that they can follow, that they can see people who have done it before them, and that it's not an impossible task or an impossible dream, that it really is achievable.